Okay, so this is going to be my week 2 fundamental skills video, and this is going to be over vital signs. So the first thing I'm going to do is just knock on my patient's door, do my hand hygiene on the way in, provide privacy behind me. I'm going to acknowledge my patient, introduce myself, let them know what I'm about to do. So I'm going to let them know I'm about to take some vital signs. I'm going to let them know it'll probably take about 5 minutes, and then thank them for letting me do the the vital signs. Next, I would assess for any allergies. And then I would just make sure that all of my items, usually you have like a Dynamap, but sometimes you would just place, if you need to place things on like a bedside table, just make sure it's clean. So I'll just show you my clean surface over here. And then, so I would just want to instruct my patient to speak, not to speak when I'm doing the vital signs, like when I'm actually doing a blood pressure or I'm taking their pulse or anything. They can speak kind of in between if they need to, and then I would just instruct them to breathe normally. Then I want to ask if my patient has had anything like hot or cold to drink recently, because that could mess with like temperature. I also want to ask them if they've smoked recently. I mean, if you're in a hospital, I would hope that your patient is not smoking. And then I would just want to look for any nail polish. So if they do have nail polish on, then I would just grab like a little alcohol or a nail polish remover and just remove that, because that can make your O2 stat inaccurate. I also want to look for so in the inpatient setting, usually your patient has an IV. Normally, so let's say the IV is on the left arm, I would want to take that blood pressure in the right arm if I could. If they had like a Limulert on for any reason, obviously I wouldn't be able to, and I know sometimes they have IVs in both arms, but I try to go away from the IV just because they have a perfectly good, if their arm's good enough to use over there, then I would do that. I also want to check, like I said, for the Limulert, so I'm looking for any like AV fistulas, any mastectomies, if they have like a PICC line over there, I don't want to mess with that, so I would not want to take a blood pressure in that arm, whichever side the Limulert is on. Next, I would just clean off all of my equipment with like a dry disinfectant wipe. So I don't have anything to show that, but I would just kind of, clean it up for use, just because you don't know the person before you if they if they cleaned it off or not. So just starting with my, vital signs, I want to first just assess any pain. So I want to ask them on a 0 to 10 scale how bad their pain is. I want to note any like aggravating or relieving factors. I want to ask them if it radiates anywhere or if it's just, in one spot. I want to know what kind of pain it is. So is it sharp? Is it aching? Is it soreness? The intensity kind of goes with, like the 0 to 10, I guess you'd say. And then is it intermittent? Is it there all the time? Is it constant pain? And then I also like to ask, if my patient, so the pain that they're having, if they've had it before, or if this is like a new kind of pain. So if my patient comes in with chest pain and I ask them, is this the same pain that you came in with? And they say no, then that could be a problem, because this may be, a different new pain or just like a different spot. So you definitely want to note that. I like to ask that just to get a better picture when you're calling the doctor and you're telling them, because it's not always possible for a doctor to lay eyes on your patient, and you know your patient more than they probably do. So, so starting with my temperature. So I'm going to just do an oral temperature. This one is obviously so we would use ones like this if you were in like an isolation room. And these ones wouldn't have like a temperature probe, but the other ones that we do carry, like with the little portable ones, usually have a temperature probe. So I'm just going to pretend like I have a temperature probe. Like a cover. So I'm going to pretend that this is my cover. So I would just put it in there, and that would be my cover. And if I was doing it orally or axillary, then you would want to put the cover on. So once I put the cover on, I'm just going to turn it on. It's going to beep. I'm going to put it in the posterior sublingual pocket. So I'll just kind of demonstrate that. So right there, and then I would have my patient, so I'd have them lift their tongue, I'd put it there, put their tongue down, and I would have them close their mouth. And then I would let that go until I heard a beep. And then I would discard so if you push a little button on the top, usually it just discards the temperature broke cover, and I would just discard that in the trash. And then I would just clean off my thermometer when I'm done, and I would set it aside because my temperature is done. So next I'm going to take my radial pulse. So I am just going to apply light pressure to my radial artery. Normally in an assessment you would be assessing both sides at once, just so you can compare like the strength and you know, you just want to compare them bilaterally. Obviously I can't do that right now, but so here's where I would just kind of feel for light pressure. And you want to be sure not to use your thumb over the artery, because then you could be like feeling your own pulse. So you're going to count for 30 seconds, and then you're going to multiply by 2. So let's say I counted for, you know, 30 seconds. Let's say I got 45, and then I'm multiply by 2, so that's 90. I'm just going to assess for, you know, rate, rhythm, the quality, and the regularity. So let's say it's, you know, 90 beats per minute. It's a normal rhythm. Quality, I would say 2+ normal, and then it is regular when I obtain it. So then after that, if the pulse, let's say, was irregular, and you would want to count for a full minute, but then you would also want to listen to your apical pulse. So using your stethoscope, you're going to use the I'm sorry, I'm like blanking. You're going to use the diaphragm of your stethoscope, and you're just going to listen for basically that heart rate. What I like to do is I like to put it there and listen to the apical pulse, and then I also like to feel, just so I can kind of, I'm making sure, because sometimes if a patient is in like AFib, it's really hard to hear those beats and to keep count. So sometimes keeping your finger on that radial pulse helps you kind of just keep count of what you're counting, especially when you have to do it for a full minute. So I'm just going to demonstrate where to go for apical pulse. So it's going to be left midclavicular line, and it's going to be 5th intercostal space. So kind of for here in this region. And you would want to be doing that over like bare skin. Just making note of that. So then after that, I'm going to assess respirations. So what I like to do is after I count my pulse for 30 seconds, I would just keep my finger there like I'm taking my patient's pulse for a full minute. And then I will just kind of watch their, you know, chest kind of like chest rise and chest fall. So just noting those respirations, because sometimes if you tell them that you're going to listen to your respirations, they don't breathe normally. And then sometimes if you tell them, oh, just breathe normally, then they're like thinking about it and it's just like really off. So you just want to make sure that your data is accurate. So I usually just don't tell them, and I just keep listening or keep feeling for their pulse, and I'm actually watching, you know, their chest rise and stuff. So for that one, you also want to count for 30 seconds and multiply by 2, as long as it's regular. So if it's irregular, then you would want to count for a full minute. Normal respirations would be about 10 to 20. So if it's, you know, less than 10, then you should probably be, you know, notifying the provider or giving your Narcan orders, basically. All right, so next I'm gonna go ahead and start taking my blood pressure with the 2-step method. So I already went ahead and just put my cuff on, and I just kind of have everything ready because it is a little difficult to get it on yourself. So what I'm gonna do, so I am left-handed, so I'm gonna take my, you know, like bulb here and hold it in my dominant hand, and then I'm gonna take my non-dominant hand and I'm just gonna feel for my brachial pulse. So basically, so I'm just kind of feeling for this, and then when, hold on, sorry. All right, let me just, getting ahead of myself, sorry. So I'm just feel for my brachial pulse. Okay, so I felt my pulse here. So what I'm gonna do is just start inflating my cuff. Oh, sorry. I didn't turn it back when I was done with it. All right, technical difficulties. All right, so I stopped feeling at 130, so I'm gonna go ahead and add 30 to that. And then I would get a 160. And then when I'm deflating, I'm going in a counterclockwise position, if that makes sense, on the bulb. And then you would want to turn it back. So you want to use it clockwise, and you would want to get it ready for when you reinflate. So after I got my estimated systolic to 160, well, because it was 130 and then I added 30. So 160 is what I'm going to pump it up to next. I want to wait 30 seconds because I want to make sure that sometimes it's kind of nice to give your arm a break, and I want to make sure that my blood pressure is an accurate reading when I do re-inflate that cuff. So I'm going to go ahead and get my stethoscope ready. Oops. And like I said, my estimated was my, what's 160. So I'm gonna go ahead and pump it up to 160. And I'm gonna use the diaphragm of my stethoscope, and I'm just gonna place it on my brachial artery right there. And I still have this bulb in my, in my dotted hand here. So I'm gonna go ahead and pump it up to 160. Sorry, so I can see this. And I'm going to slowly start releasing. So 130 was my systolic, is where I heard the first sound. And then 72 is where I stopped hearing the sound. And then you just want to make sure that you're listening. So when you stop hearing your sound, you want to make sure you keep listening. You keep listening to that, and then slowly start to, deflate a little bit more. Sorry, I may have went a little faster than, I know they say to do it like 2 to 3 millimeters of mercury per second, but I probably went a little faster. I'm sorry, I'm kind of used to doing that. So yeah, so 130 over 72 is what I got. And normal blood pressure would be like 120 over 80. After I was done with that, I would want to make sure and just clean off my blood pressure, machine, the cuff. Most of the time in the hospital, the cuffs aren't like attached to the like the Dynamaps or anything. So and those are just like disposable. So you really would need to clean that off because it's only one patient. But for my purposes, I would just clean that off. Just with like a sandy wipe or an alcohol wipe, just to get all the germs off. So after I am done with my blood pressure, I'm gonna do my pulse ox. So this is my pulse ox right here. I would just wanna look and make sure that they don't have any nail polish on their fingers. I also sometimes just like to, especially like my older patients, make sure that their hands are warm. Because if your hands are super cold, you're probably gonna get a false reading. So if their hands are super cold, sometimes I'll just kind of like hold it in my glove a little bit and just kind of warm their fingertips up, or you can get like a warm blanket and put them under it, put their arms under it for a few minutes until they kind of warm up. So this is what you would do just for a pulse ox. You would just place it on the finger, and then you would wait a couple seconds and it would pop up like a reading. Sometimes you have ones that have like the waveform, and it'll give you the number as well. So anywhere from 95 to 100% is a normal pulse ox. So mine would probably be closer to 100. And I'm just, on room air, I'm not on any oxygen or anything like that. So I would just, document that. And then I would just make sure that I would clean it off before I, if it was like my portable one, then I would just clean it off. So lastly, I know I kind of said that I would clean equipment as I go, and you totally can, but you just want to make sure that everything is cleaned with like a moist disinfectant wipe. After that, I'm just going to tell my patient, hey, thanks, this wrapped up my vital signs. I'm just going to make sure that, I do my hand hygiene, my bed is in the lowest position, my bed's locked, their call light is within reach, side rails are up at least ×2. They have either their bed or their chair alarm is on if they're on fall precautions, super important. And then I would just ask them, you know, if they need anything else before I leave, if I can bring them anything like a blanket. I definitely want to reassess their pain just to make sure that there's anything that I can bring them, you know, pain-wise, or, you know, just assessing, you know, maybe it's been an hour after they've had pain meds and I need to reassess anyway. So I'm already in there, so I might as well just ask them. And then just, you know, thanking them for letting you, you know, do the vitals, and then just doing hand hygiene on the way out. All right, so last but not least, I'm gonna do my documentation. So first off, I just wanna make sure that I'm in the right patient chart. So I just wanna check name and their birthday, make sure, you know, just like identify, make sure I'm in the right chart. Next, I'm gonna document my pain. So I wanna document if they reported, if they did, you know, report pain, but you would also want to document if they didn't report pain. So let's say my patient had pain 3 out of 10, and it was in their back. So that would be the location. Intensity would be the 3 out of 10. Quality, so let's say let's say it's like an aching pain. Duration, it's been lasting for, I don't know, let's say 2 hours. And then pattern, so pattern could be, you know, like, is it off and on, like, is it intermittent, is it there all the time? And then you would want to know like the onset, so when did this first begin, how long it's been going on, kind of that kind of stuff. After that, I'm going to document my temperature reading. So let's say I got, so in my video I did an oral temperature, so I would want to note, so it was 98.6. I would want to document the 98.6. I want to let them know the root, so it's oral, and then like I said, the reading, so you'd want to document that. Let's see, sometimes I know too you can document like interventions and stuff like that. So like if they're running a fever, you can let them know that you like put a cold cloth on, or you gave like an antipyretic. Sometimes you can do that in your charting too. I know that. So next is going to be, I'm going to document my pulse. So my pulse was 90 in my video. So and I'm just noting the rate, the rhythm, the strength, and then where I did the pulse. So I know I did radial pulse, but then I also listened to my apical pulse. So you could also put in your charting, you know, if your apical pulse was irregular, you could note that in there. And you could also note like that your initial radial pulse was irregular as well. Next is going to be my respirations. So in my video, let's say I had 12, I was breathing 12 breaths per minute. So I want to note the rhythm, the depth. So I would say mine are normal. I don't have like shallow or, you know, shallow respirations. My rhythm is regular. I don't have any oxygen on, but if I did, I would want to note, you know, how many liters I was on of oxygen, and then like what I was, like what it's being delivered by. So let's say I'm on 2 liters nasal cannula. I would want to chart that with my well, respirations and O2 sat, because you could chart it. Usually it's all in one, but either of those I think could, you know, you could chart them either way. Next is I'm gonna document my BP. So my reading was 135/70. So I would document that. I'm gonna document that it was taken to my left arm, and usually it asks if it's like manual or electronic. This was a manual blood pressure, and I was sitting up for that blood pressure. Next, I'm gonna document my O2 saturation. So I did it on my, I think I did it on my right finger. Sorry, my right, you know, I don't really think, you know, I don't know. I think it was my right finger, right index finger. So, you know, reading would be, I was 98% on my right index finger. And then you could also document like the waveform if you needed to, like, you know, if it was regular or anything like that. I've never done that, but you can. And then you can also document your oxygen saturation here, like I said. So the next, you would just maybe document like if the patient was able to like participate. So like I asked my patient, you know, can you raise your arm so I can put this blood pressure cuff on? And they were able to participate in that. So that's, you know, that's a good thing. If you had to do any interventions, so if you had to, I don't know, let's say your blood pressure was out of whack and you had to call the doctor. Usually I just put a little note in, like with the blood pressure, I usually just put like MD notified, or I know techs usually will notify, like I'm an LPN, so my techs will notify me. So usually it'll say like RN or not. I mean, they usually put like nurse notified. And then if you did any interventions for like temperature, so if you put like a cool cloth on them or anything, you could put that as an intervention as well, which I know in my documentation, it's usually in there. And then if you educated anything, or if you, did any education. So let's say, I don't know, their, blood pressure was abnormally high and it's not abnormally high. Maybe ask if you're in like a clinic setting, like, oh, did you take your blood pressure medication that's prescribed? Maybe hospital setting. I mean, there's not, I don't know what you could do. I guess you could ask like, most of the time, you know what you gave, like, as the nurse. So you could be like, oh, okay, well, I haven't given your medication yet, so that's normal for it to be, kind of high. So I'll give you your medication and we'll check it, in an hour and see where it is. I guess you could put that. And then you could just document the, like the response. If you did education, like, are their willingness to, like accept this education, kind of stuff like that. Did they verbalize, did they verbalize understanding? Did they give you any like teach back, kind of stuff like that. And then documenting that, they tolerated the blood pressure. Some people, they're just like, it's way too tight, I can't tolerate this. Other people are totally fine. So you want to make sure that, documenting tolerance. And then usually with electronic, so I know in the checkoff it said like nurse initials / like signature. If you were doing like paper charting, definitely. I know when you're logged in under like electronic medical record, it automatically like goes under, you're under your account and it says like who puts them in and all that stuff. So your name is essentially attached to, everything. But I guess just make sure that you're on the right chart and that you're not charting under someone else, I guess is what you do.